If you are looking to lose some weight and feel healthier, the Mediterranean diet could be your best bet. For the 7th consecutive time, the Mediterranean diet tops the list in U.S. News and World's Report annual ranking of diets for 2024. Joining us now is Dr. Jeff Pothof, UW Health's Chief Quality Officer. This is really no surprise, right?
You know, not really. The Mediterranean diet now for close to a decade really has been highlighted as probably the best diet that people could adhere to. As a lot of people know, heavy in fruits and vegetables. There's olive oil there, olives, high fiber grains, fish, but then, not as much red meat, very rare, and then even a little bit lower poultry than what we would typically eat. When you look at the data, though, up to 30% reduction in heart disease, stroke, helps prevent diabetes. You can not lose weight on the Mediterranean diet if you eat too much, but combined with some exercise, a good diet plan all around, and it lets you drink wine.
Oh, well, that's a plus too. Got to get the antioxidants. And when it comes to diets, Dr. Pothof, I mean, it has to be sustainable because there's so many of these diets out there that are so restrictive or so, totally to one end of the spectrum that at some point you're going to kind of come back to the middle, which, sometimes everything goes out the window at that point.
You're absolutely right. We see a lot of people who adopt a fad diet, and many of them will work, but they're not sustainable. There's no way you can live the rest of your life eating that way. That's where the Mediterranean diet has a bit of a leg up there. It's different than a typical American diet, but it's absolutely sustainable. The food is tasty, and you can do that for years and years on end. So certainly, if you're looking at best diet, how to live healthy, look into the Mediterranean diet. It's a really good option.
Got to cut out the fried chicken wings. That's the key. Last night we first reported on FOX 6 News at 9, and it was pretty eye-opening. There's a new study that shows babies born to women who contracted COVID-19 while pregnant had unusually high rates of respiratory distress at birth or shortly thereafter. Can you talk more about this, and what is your take on it?
Yeah, so this is an interesting study. So if we look at infants who are born to mothers and those that have respiratory problems at birth, typically like low respiratory rate, maybe having to work extra hard to breathe, or even looking a little bit blue at birth. If you take all comers, somewhere around 5 to 7% of infants that are born have that. If you look at women who had COVID, and not just like proximate to delivery, but during their pregnancy, that number jumps up to 17%. And if you look at women vaccinated versus unvaccinated during their pregnancy, 3 times higher in those who are unvaccinated. And we think this is all starting to come together with other studies that are showing that COVID causes a prolonged inflammatory state, both in the mother, but also probably in that infant, that then kind of attacks that lung tissue, makes it harder for those folks or those babies to breathe when they're born. Likely some of the same drivers of long COVID. It's all starting to make sense, but concerning that infants born to mothers of COVID have this elevated risk of difficulty breathing when they're born.
4 years out, and we're still learning so much more about this disease. There is some promising news, though, when it comes to children with hereditary deafness. Gene therapy seems to be working and working well.
Yeah, this is a really pretty amazing study. Small number of patients in this study, but basically they use gene therapy. So using a virus to put a protein in the middle ear of these small infants with a particular type of hearing loss, a certain protein, and it worked. 4 out of 5 went from not being able to hear to having hearing restored. That's pretty amazing. We don't have a lot of therapies that are like this at infancy to address deafness, which isn't as uncommon as you might think. Obviously, more trials. 6 kids is not that many, but pretty impressive stuff. Kudos to the team who pulled this off.
Well, and you think about what else gene therapy can do in the future with so many other different, hereditary ailments. Fascinating. Dr. Pothof, we appreciate it. Thanks.
Thank you.